Let's talk about cartilage injuries. Cartilage injuries can be very disabling for a patient because the joint movement is restricted, and it is a progressing disease because a small cartilage defect eventually increases in size and also the depth, which means that the cartilage completely gets worn off over a period of time if left untreated. So cartilage injuries, as we all know, is also related to arthritis, and cartilage injuries lead to arthritis. Cartilage injuries is very common due to injury, due to fall, due to trauma in younger age group, but can also happen in older age group due to wear and tear of the joint. So cartilage is the smooth surface covering over the bones which make the joint smooth and which give a perfect articulation to the joint. When the cartilage is not smooth or is irregular, it leads to pain, difficulty in joint movement, and also difficulty in our day-to-day lifestyle. Most common cartilage injuries happen in the knee, and also that can happen due to injuries, due to fall, due to trauma, or also in people who participate in active sports. Cartilage injuries earlier could be very debilitating because that could lead to joint restricted movements, persistent pain, restricted activities of daily living. But now, advancements in the technology and in science, we have measures wherein we can treat cartilage injuries. And we can treat cartilage injuries in various ways. Depending on the size of the defect and the placement of the defect, there are various treatments that we can offer to treat the cartilage injuries. Per se, if I talk about a younger age group who has sustained an injury into his knee joint, for example, and has having a focal cartilage damage, or a piece of the cartilage is lost, or a piece of the cartilage is damaged, we can regrow the cartilage, which was not possible earlier. This is done through Cartilage. And Cartilage is a method wherein it's a two-stage process, wherein the first time we take a small piece of the cartilage, grow and take out the cartilage cells and grow them in a lab, one of its kind lab which is there in India, which is near Mumbai in Lonavala, wherein we grow the cartilage cells. The patient's own cartilage cells is grown in the lab. It comes back to us after about 4 weeks, and then we implant it over the defect. So the knee joint which had a cartilage defect earlier can now have a original patient's own cartilage regrown over the defect. This really helps in patient who are having the cartilage injuries, and patient can get back to their own active lifestyle and even sports. We've done several such cases over the past 20 years now, and wherein we have got very good results and patients come back to their active lifestyle just like before. Cartilage over the past 20 years has been giving us cartilage cells regrown from the patient's own cartilage, which enables us to get back the cartilage, a hyaline-like cartilage, into the defect. This not only prevents major surgeries like joint replacement, but also gives the patient an active joint, pain-free, active lifestyle. All methods and treatment are directed towards restoring your knee joint, giving you full mobility, a pain-free life, and getting you active back as ever. Let's talk about avascular necrosis. AVN, as we all know, is a very common and increasingly debilitating problem which we are seeing even in younger age group now. This happens in conditions where the blood supply to the bone is reduced and the part of the bone dies. Most commonly happens in the femoral head. As a result of this, patient feels a lot of pain in day-to-day activity and even walking and while doing basic activities. The pain is very disabling and the patient's activity levels get very reduced due to overuse of steroids, maybe during the time of corona, or also due to increased alcohol intake and also some genetic issues. Avascular necrosis is a condition where the bone starts to die on its own. Some part of the bone can have reduced blood supply and the blood supply stops, which leads to death of the particular part of the bone. This leads to joint arthritis, and which causes a lot of pain and debilitating for the patients, and also takes away the joint mobility, and also the activity level of the patient goes down. Hip joint, being the main weight-bearing joint of the body, has to be active and has to be perfectly mobile for the patient to have an active life. Usual line of treatment for avascular necrosis is physiotherapy, some oral medicines, some injections, but which have been seen to not work as very well in long term. And as the disease progresses, the patient often requires a joint replacement surgery. Avascular necrosis of the hip joint is very common, or if the stages increase, then the only option is left is with a joint replacement. But in earlier cases, we can also regrow the bone using Osgrow. Osgrow is a method, or we take the patient's own osteoblast cells, that is the new bone forming cells, we take it from the bone marrow and grow them in the lab, implant it into the bone where the bone is dying. This way, we can regrow the bone to its normal strength and normal self. More than 10 years, they have results of more than 5,000 patients who have benefited with this treatment. Wishing you a very active, pain-free life with healthy joints.